understanding of our consumers, their needs, values, and communication preferences. Accordingly, a well-thought-out marketing strategy is vital to the success of your organization. To stay competitive, you must also continuously measure effectiveness and make appropriate adjustments. Topics discussed today will include how to conduct an internal audit and environmental scan of current products and services, consumer characteristics, and utilization patterns, how to identify and prioritize strategies, goals, objectives, and most importantly, actions, how to develop and implement matrix for each action. The list would include resources, staff, time, money, etc. Identify report card metrics and measurement tools and protocols that we'll use to measure our effectiveness. Measurement tools and resources that we have available, and a cost-benefits analysis, which we all know is very important to all of us in leadership and the leaders that we're serving. So with that, the next thing I'd like to do is to introduce our speakers. First is Mr. Bob Redell. After almost a decade of working with clients in industries such as financial services, QSR, food service, transportation, and healthcare, Bob has earned a respected reputation in the agency world. He's racked up an impressive portfolio of experience with top name brands from across the United States, including TD Ameritrade, Arby's, KFC, Conagra Foods, Quote Senior, SCL Health System, the Spine Care Institute, and SurePoint Medical. Bob is currently one of the lead account managers with Hippo, the creative alternative to healthcare marketing, located just outside Kansas City in Leawood, Kansas. There, he focuses on creating and managing effective marketing strategies and maximizing the value of the healthcare's clients, products, and services. Our next speaker after Mr. Redell is Mr. James Farrell. Jim's a Senior Vice President for Marketing Communications and has been actively involved with the OSF Corporation since 1997. Prior to that, Jim served as Director of Marketing, OSF St. Francis Medical Center in Peoria from 87 to 97, the Senior Manager of Market Services for Madison Gas and Electric Company in Madison, Wisconsin from 84 to 87, Director of Marketing Research at the University of Wisconsin Hospitals and Clinics in Madison, Wisconsin from 80 to 84, and Director of Marketing Research of the William C. Brown Publishing Company in Dubuque, Iowa. He earned his bachelor's degree from the School of Business, University of Wisconsin at Green Bay, and his MBA from the University of Wisconsin in Madison. Jim is on the adjunct faculty of the University of St. Francis Joliet, Illinois, teaching courses in Health Services Administration's programs since 1992. Okay, and with that, I would like to turn the presentation over to Mr. Bob Redell. Bob?
Thanks, Dave. Thanks. Appreciate that. Good afternoon, everyone. I appreciate the opportunity to speak with you all today. As Dave said, I'll be talking to you about the first part of the presentation, and we'll get into that right now. Really wanted to talk to you all about marketing planning process and kind of a couple ways to approach the early stages of that. Both internally and externally, there are ways to do that, and that's going through an internal audit and an environmental scan. And I'll get into what each of those are here in just a minute. But the reason why we want to do that is because we want to come to the whole process of a clean slate and to make sure that we're not getting stagnant in our approach. So there are some different ways that we can go about doing that. And as I said, the first way is through an internal audit. And that's really just taking an inventory on what's going on, getting the internal temperature of your organization. You want to engage the associates, and really, the associates are your brand ambassadors and your champions inside the organization. So if you've lost them on previous, projects or campaigns, you want to try and get them back in some way. So you can engage the associates through a number of different ways, whether it's attending their department meetings or just maybe an informal setting if there's a coffee shop inside, you know, if it's a hospital, for example, if there's a coffee shop, just go down and buy them a cup of coffee and just get their feedback. So that's a big thing right there. The next thing is you'd want to determine whether you have maintained custom brands across all of your products and services. And obviously this is important. We think we do a good job of it. But you know, you want to make sure that your past projects and campaigns that you've done have followed the established style guidelines that you've set forth. If, for example, you have a print ad in a newspaper and you've used a certain logo, you want to make sure you consider or continue to use that logo. I've worked with organizations in the past that have 5 or 6 different iterations of the same logo, and they have no way of knowing if there's any consistency there, and it confuses the public and confuses the consumer. So you want to make sure you've maintained consistent brand across all of those products and services. The next thing is making sure you have a unique selling proposition. You know, what sets your product or service apart? And what do you want to promote most? So what sets you apart from your competitors? And I'm going to give you some examples of that here in just a few minutes. And then the last thing on the internal audit that you can consider is creating a list of what you've learned from past projects or campaigns, marketing strategies that you've put together. We've all made mistakes, so we should obviously remember those and how we avoid doing those again. But we should also have, you know, some best practices that maybe we've done in the past that obviously we can lean on for guidance as well. Talking about an environmental scan, you may ask, you know, what is that exactly? It's really just a way of looking at what's going on with your organization from an outside perspective. Look at it in different ways and through different lenses. Look at everything through both a worldly view and a local perspective as well. There's a lot of things happening that affect your organization and the products and services that you're wanting to promote that you may not think about inside your organization necessarily, but other people are talking about it out there. So you want to kind of get a pulse for the community's perception, and you can do that through a lot of different analytic channels, whether that's surveys or focus groups. I have clients who do community perception surveys at least once a year, and that's a great way to get a pulse on what's happening out there and what people think of your organization and the products and services they have. So last thing here is kind of determine what new factors have been introduced into the marketplace to your target audience that could positively or negatively impact your plan. You want to look at things, as I said, through both from a macro and micro perspective. So for example, from a macro perspective, how does the Affordable Care Act affect what you're wanting to promote right now? You know, insurance-wise or whatever, there are a lot of different ways that Affordable Care Act could affect that. From a micro perspective, more local perspective, is there new competition in your marketplace that you have to contend with that maybe you haven't thought of before? In addition, you know, were there any new studies or guidelines released that may open or close the door on potential new consumers or patients? For example, I'm working on a new bariatrics and weight loss surgery campaign for one of my clients, and as recently as yesterday, there were some new guidelines released by the American College of Cardiology and the American Heart Association calling for more aggressive treatment, proactive heart health treatment, and included in that, they specifically mention bariatric surgery. And so you better believe I'm going to include that as part of my backup and my messaging out there as part of my new bariatrics campaign, and tie that into maybe our heart and vascular campaign as well. There are ways to cross-integrate those different service lines. So kind of answering some final questions after you've conducted your internal audit and environmental scan. By this point, you should have answers to the following. You know, what are the community and patient needs out there? I know Jim's going to get into a little bit here, the community health needs assessments. So he'll really dive into that. But you can use different different sources like that CHNA to find out what those community patient needs are. How does my unique selling proposition put me in a position of strength? Are we the only organization in town that offers this product or service? Do we have the only center of excellence in the area? I'm working on a campaign right now to promote women's services, and specifically a birthing center for one of my clients, and our competitor is literally right across the street from us, and they have a level 3 NICU. Unfortunately, we only have a level 2 NICU, so I've got to find, what is my unique selling proposition, and how can I use that to my advantage? Well, after going through and doing some focus groups and, other things like that, we have figured out, not everybody needs a level 3 NICU. The majority of kids, if they're having babies, if they're having troubles when they're born, need a level 2 NICU. So that's one little feather in our cap, but yet you're thinking, okay, the mother's like, well, why take that chance? I'll just go to the place to level 3 NICU. One of the things that we found is that we actually offer some things that our competitor across the street does not. And we're going to kind of hang our hat on that, and those include hotel-like amenities. So whether that's bigger, newer rooms that we offer queen-size beds versus the little single-size bed. We have gourmet food. We found that these are all things that trigger our target audience to say, yeah, I want those things. So we're going to use those and position them, and they will become a strength for us. So while we won't be talking necessarily like, hey, we only have a level 2 NICU here, but we also have these things as well. So, and then the last thing is, what resources are at my disposal to carry out this plan? Obviously, money is a big thing, but it's not always about money either. It could be about time as well, because you can develop some campaigns and promotions around social media, for example, and that doesn't necessarily take a lot of money, but it may take a lot of time and effort and engagement to really win over that target audience that you're seeking. So next is kind of writing your plan. After conducting that internal audit and environmental scan, to answer those questions, you'll need to be able to identify the necessary puzzle pieces to finish your plan. So, for example, if I'm writing a plan for a heart and vascular campaign, my marketing plan is basically because I've been told this is a strategic priority for us to grow this service line, or we've got a new technology here, a new product, a new service that we're looking to offer. We really want to promote and let the community know that we have this. So, there are goals, objectives, strategies, and actions. The goals are the declaration of what you want to accomplish. So, for example, for this heart and vascular campaign, my goal is to grow market share in our heart and vascular program. The objectives are the measurable piece that must be achieved in order to reach that goal. So for this heart and vascular campaign, for me, my objective, one of the objectives would be increase physician referrals and appointments made. Because if I know I can do those things, I'm going to reach my goal. And then we go into strategies. Strategies are that stated plan of action on how you will reach the objective. So, for example, one of my strategies would be working with a physician liaison to inform primary care doctors about the newest heart and vascular physicians and technology that we employ. Maybe we brought on a new electrophysiologist, and he's doing, AFib treatment. So that's something that we need to let the primary care doctors know about out there. And then we've got the actions. So these are the specified tactics that we'll use to fulfill that established strategic direction. So for example, one tactic I might have to support my strategy would be to create a brochure or an online video that can educate those physicians on our latest heart and vascular offerings. Maybe it's creating a short 2.5-minute video to let them know, here's what AFib is, here's how our electrophysiologist can do it. Maybe we're the only one in the area. Send your people our way. So then there are ways that, we can prioritize our plan. There's a lot of different ways you can do it, but we want to know, what is the most important thing important ways that we can make this as successful as possible. So there's a number of different ways we can do that. One of them is to list out, gain maximum exposure versus minimum expenses. So what can I get the most bang for my buck, essentially? Is that with a 30-second TV spot? Well, there's a lot of production expenses and creative expenses that go into that. How many people are going to see that? What is the call to action? Is that really worth it versus possibly a video, a 2-minute video, and that costs me half as much money, but I can put it online and support it online, and I would probably get just as many, if not more, views, and I would actually get probably more interaction and engagement through the target audience that way than I would by just putting out a TV spot, for example. Encourages brand and project champions, internal and external. What are the things that I'm doing through goals and objectives, strategies, and actions that are really going to have people both in my organization and outside say, yeah, I get that. I want to stand behind that. I support that. So that's one way you can prioritize, how important is that to you? And then the last thing is short-term success versus building long-term foundation. So, for example, the heart and vascular campaign example I gave you, short-term success is getting people inside the door, getting those doctors to refer patients to us, getting new appointments set up. But building the long-term foundation would be, setting our organization up as having the newest, the best physicians and technology out there. People will come to realize that we are the organization you need to come to for your heart and vascular needs. So in conclusion, you can, as I said, you can get the most out of your planning process by conducting that internal audit and engaging the temp of your brand ambassadors, surveying the external landscape and administering an environmental scan, and then weighing the different contributing factors that will help prioritize your goals, objectives, strategies, and action items. Are there any questions? Okay. I will hand it off to Jim.
Okay, thanks, Bob. And I guess they're supposed to wait for questions until we're both done. So nice job.
Thank you.
Okay. Maybe Greg could, there we go. Thank you. That works out, Greg. You read my mind. All right, so Ashley asked me to also review a little bit about what I previously addressed, and so I'm going to quickly do that and then get to some new information. So, but back in September when the three of us presented, we talked about the role of senior executives and how they serve as the liaison between resource allocation, which is really what Bob addressed in terms of identifying the importance of that and how you're going to spend your money. So executives like yourselves, do serve a really critical role as to prioritization. So that's one of the things we talked about the first time through. And then how do you ascertain the need for new products and services and why these needs are currently unmet? And then we also addressed the new or the elusive ROI. So the next item that we addressed were ways to evaluate the effectiveness of marketing, and in this regard, I shared the fact that it could be number of times something is seen or heard, and that typically is referred to as reach and frequency when you're buying media, and as we have questions, Bob could probably more adequately address that, but I'd certainly be happy to talk about that too. Then the next item is percentage of time your program or service is remembered or preferred, and a lot of times us marketers will call that share of mind. So if someone prefers your particular program or service or organization, then they're more likely to select it when they need it. And we all realize that so many of our healthcare needs are latent demand. So meaning that I may see something about an exercise program, but I feel pretty comfortable with the way I'm currently working out at a particular facility, but I may have an injury, and then that may cause me then to modify what my exercise is. And so the latent demand is I have to then think, okay, where am I going to get this rehabilitation services in order to help me get back into my right path of exercising? Then another way that we can evaluate effectiveness of marketing dollars is the actual utilization, and that's what the third one is here. Number of times your program service was accessed, and what was the direct contribution margin and resultant ROI. We talked a little bit that first session about just how tricky that is and how time intensive it is, at least for those of us in various organizations that do not have an automated marketing or a customer relationship management computerized system. So if you don't, you're going to have to work with some analysts, either in your decision support services or performance improvement, to assist in that regard. So let's see. I think. Okay, good. I'm on the right one now here. So the next one is why should we or why should you as executives focus on community health needs of the community? And it goes back to one of the major points that Bob had, and that is determining that really does help you prioritize how you can allocate your dollars to best meet the needs of the community, and at the same time carry out your respective missions and visions of your organization. So for us at OSF, the Community Health Needs Assessment aided us in our strategic decision making as they directly relate to the health needs of the communities that we serve. And so we did studies, as I referenced before, across all 8 of our service areas. And the next slide will show that there's a matrix here that indicates what the different health needs were as we went across our entire ministry. And so if your screen maybe has a bigger printout than mine, but what the column headings are is the far left column heading is a county, and then it has OSF hospital, and then it does actually have the prioritized needs. And so as you're looking at the needs, access to health services, asthma, cancer, and it goes all the way down to the far right to substance abuse. So in the next slide, we have the implementation strategy. And so what we did is we took you can see at the top where there's a little arrow there, it says prioritize health needs. And those are the 7 or 8 that are listed across the matrix. But then as you look to these different bubbles, you have community resources in the I'll call it the beige colored bubble, and we as an organization need to look in our respective 8 service areas as to what is being provided now in our respective communities that are addressing some of these key health concerns. And so that's one aspect of an implementation strategy. Then we have to look internally and see, okay, what types of programs and services does OSF currently offer? And again, it's by each of the 8 service areas. And then what new programs are we either considering or ought we to consider to help address those respective community needs? And then there are, in addition to community resources, there's also communication efforts that need to be done to share with those people who are affected by these respective needs, to let them know what resources are available. And one of the interesting things that we found in each of our 8 service areas is that a lot of people who are either on Medicaid or below poverty level actually have some type of a smartphone. And so we can utilize social media, whether that's Facebook or Twitter, to communicate with some of these people. And you wouldn't necessarily expect that from that type of an underserved population. So when you look at that equation and you see the equal sign, it says, OSF healthcare implementation strategy. So I'd like to present, how we're moving ahead with this matrix approach, matrix management approach to our community health needs assessment. So on the first of the next 3 slides, what you'll see is you'll see diabetes in the upper left-hand corner. And on this particular one, the column headings, again, if you can't read that, talks about the objectives and goals, specifically addressing diabetes. What's our strategy going to be? What actions are needed? Are there existing OSF programs? What are the community resources available? What impact or how are we going to measure whatever we do in our objective or a strategy that we know that we actually did something that we can report to the IRS on our 990 form? And then, do we have any dollars budgeted in this current fiscal year? And if so, how many? And the same thing with FTEs. And then, just down below on those 2 respective columns, we have what additional dollars do we think we need to budget for fiscal year 2015. And so as you look at the paragraphs underneath that particular chart, it says existing program descriptions, and it has the Joslin Diabetes Center affiliate, and it also has the Pediatric Resource Center, Diabetic Resource Center. And these 3 charts that I'm going to just quickly go through are for OSF St. Francis Medical Center. And so these charts were developed by our Performance Improvement Division, and they were completed for each of the medical centers' major service areas. And so they went ahead and canvassed all of the different areas to identify and to help fill in, what are the existing programs, what are the community resources, and used the community needs assessment that was completed for each of the respective hospitals/service areas. And so by using this particular approach, it does a couple things for us. One, it gives each of the implementation teams in our 8 service areas a jump start on putting together their implementation strategy. And then second, and just as importantly, is that it has a consistent format and consistent information for each of the health needs that are identified in each service area, so that when our board of directors reviews each of the implementation strategies and plans, that it'll be much easier for those individuals to absorb what we're going to be doing across each of our 8 service areas. And so as you look at the one for asthma, you can see that there's a lot of TBDs, and some of that information wasn't available in the needs assessment, and so there's going to need to be more work done in the implementation team here at OSF St. Francis Medical Center in order to fill this one out. And so as we go to the next slide, the risky behaviors one, you can see we have for community resources a lot more completed, but in terms of actions needed, that's another area that we're going to go ahead and need to really work on. So in order to fulfill that last part of the equation on the community needs implementation strategy, communications is a real key part. And so what we've done is we put together a matrix, and this matrix, and as Dave gave my introduction, you understand I went to UW Green Bay, so the colors have been intentionally and carefully selected for this matrix. And despite being in the heart of Bears country, people go ahead and allow me to have my fun with the Green Bay Packers colors. But nonetheless, for the column headings, we're dealing with key audiences. What is our communication medium going to be? And Bob addressed, the different types of things, whether that's traditional media of television, radio, newspaper. It could be billboards, and it could be the newer media, online. He referenced a couple times social media, whether that's Facebook or other search engines that are out there like Google and Bing and Yahoo. And so communication medium is certainly one of the things that we want to address with each of these respective key audiences, because some people are more tuned into different medium than others. What are our main messages going to be? Who's going to be responsible for making sure that this actually gets implemented? And then what's the timing going to be? And since we developed this particular matrix, we've decided that we should add a whole new category, and that would be community resources. And we would put school districts in there, United Way, Salvation Army, and then we'd move down from the community leaders, the public health department, because they're going to be critical to what we want to do. So I thought what I'd do is just maybe walk through a couple examples of a communication matrix that we actually use. And so the next slide then is a communications matrix that I worked very closely with OSF St. Elizabeth Medical Center in Ottawa in developing a communications effort and communications plan, again based on a matrix management approach as to how we could introduce the fact that both of our organizations signed a definitive agreement. And so what you have on this first of a whole series of slides are those individuals in Ottawa that are part of our key audiences, and it starts at the top with their regional board of directors. And then Ottawa had a very interesting organization called their regional community members of the board, and they actually, and that's not a typo in parentheses, they had more than 400 community members. And what you're probably wondering, if you're not from the Ottawa area, how does that work? And how that worked for a nonprofit organization is that they had a building effort that they wanted to embark on to move the hospital from downtown Ottawa to its current location. And so they asked the community to pitch in as a fundraiser, and for $100 or more, someone could become a community member. It's not too unlike what the Green Bay Packers have done in terms of selling stock to all of the fans in Wisconsin and throughout the country to raise money. And so that's where they got their group of community members. And so each of them had one vote for each quote-unquote share that they had. But all shares were just one vote each, regardless of how much money they gave. So that was a key audience that you don't really see in many smaller communities where you have a community hospital. And so if we went to the next slide, that one will illustrate at the top some of the area hospital CEOs. So for those of us that are pretty familiar with the Interstate 80 area, we realize that when you go from Joliet all the way to the Quad Cities on I-80, there's probably 7, 8, 9 hospitals in that area, and really close to Ottawa are a whole host of hospitals. And so we wanted to make sure that we were regularly keeping those hospital CEOs apprised of what we were doing in that area. And then as you get to the middle of this particular matrix, and I see someone put a question up in terms of, are we going to be sharing these slides, and you'll be able to see this a lot more clearly. We start with the OSF individuals and the key audiences for OSF, starting with our board of directors and then going to Rockford and their community advisory board and their leadership. So as we go to the next slide, we have just Pontiac and Bloomington, which again are two of the more closer or healthcare facilities to Ottawa. And then if we go to the next slide, you'll see that on this particular one, we have two that I want to point out, and that's the independent affiliates of OSF. OSF healthcare system has a program where hospitals can become an independent affiliate and get access to our purchasing power by becoming an independent affiliate. Plus, we also provide training, expertise and training opportunities and programs for clinicians and other people that are part of the independent affiliation, but there's no financial or fiduciary relationship. And then as we go on to the next slide, we can probably skip even to the next slide down, that the point I want to make on this one is this is the remainder of OSF, because our organization, we wanted to make sure everybody was informed about this definitive agreement. And you can see in the bottom right-hand matrix how many times we updated this particular document to make sure that it was flowing appropriately to have the latest information. You can see sometimes there's gaps and sometimes there's a lot of activity. So on the next slide, what I've identified is how we support that communications matrix. And the process that we used and that we walked through was what we call an S-bar. And for those of you who probably have a clinical background, you probably are familiar with an S-bar, where you identify what is the situation for S, and then B for background, and then, you know, how did the situation develop? So that's the background. Then what is your assessment, so the A for it, and then the R for recommendations is, you know, what are we going to do about it? And so as you go to the recommendations slide, which is the very next one, we came out with a timing for what we wanted to do on a couple different days, on January 18th and January 19th, and then we extended it to March 1st because that's when there was a regularly scheduled meeting with their corporate membership or their community membership. So as we go to the next slide, then what we did is we took the same type of matrix approach and we used that to plan our integration. And so Karen Broadbeck, who is the Director of Marketing and Community Relations at OSF St. Elizabeth Medical Center, then took an ownership role using the template that we had before, and then was very active in terms of completing, you know, what is our communication medium going to be. And you can see as we look at employees in that first box, we have integration update and a banner letterhead, or on banner letterhead. So we developed an individual hard copy of a weekly integration update that we provided for 10 or 11 weeks in a row, and we also posted that on bulletin boards. We made it available to all of our executives. And so as we go through these different matrices to the next slide, and then I think even the next slide after that, we get to something that's very detailed. And again, this is another example of supporting the matrix, where we had the S-bar kind of fleshing out some of the timing specific for that communications matrix. Now we have what we reference as what are the key business objectives that we wanted to address in that integration effort. And so those are identified, and then what are going to be our day one requirements for go live as OSF St. Elizabeth Medical Center, and then what is the steady state for day 100. And the next slide then goes to the day one deliverables, and again another example of a matrix where we're looking at what is the deliverable, and then what is the different comments that we have related to that. And then we have the same situation for day 100, which is the next slide. And then the last slide in this set we could probably go to as well, and that refers to our status report for marketing, communications, naming, and branding. And again, that walks through the summary of our major accomplishments that we went ahead and tracked week by week, so that leadership would know how on target are we relative to what we're trying to accomplish, and looking at those day 1 requirements and the day 100 requirements as our respective objectives. So that wraps up my presentation, and well, I guess it almost doesn't, and that is tracking and ROI is more than just matrices. And I've referenced S-bars, and S-bars can be in Word documents and certainly Excel spreadsheets, but there's a lot of meetings that go on, there's a lot of analysis that goes on in order to, again, support that matrix that looks pretty simple on the outside, but in terms of fleshing it out is a lot of hard work. So now that, I think, wraps up my portion of it. And then I'm going to go ahead and share Gene Vogelgesang's slides. Gene is the Director of Public Relations and Community Relations at Illinois Valley Community Hospital. And he unexpectedly had a family commitment that came up at high noon today, so the time that we were scheduled to present. So he sends his apologies, but lucky for me and for you that he had these slides prepared well ahead of time, and so he gave me some really good points to address these different slides. And so as we look at measuring marketing effectiveness, Gene would tell us that certainly, like with everything, there's pros and cons. And so as we look at the next slide, Gene does address the pros, and some of the pros are, in terms of marketing your effectiveness, is that you avoid costly mistakes. You have an opportunity to evaluate alternative strategies, because in most of our marketing programs, it's not typically a one-and-done type of scenario. It is something that, especially if it works, you're going to be doing it again, but there may be other situations where you may have to use a similar approach. So by evaluating alternative strategies, that will give us an opportunity to see what might be even more effective the next iteration around. The other thing is, and I've referenced this too, and so has Bob, increase the efficiency of advertising in general, and then determine if our objectives are actually achieved. So as we go into the cons, there's a cost to doing this, and just like anything, there's a cost of measurement, and sometimes there's disagreement about what to test, and then who takes the credit or / blame, depending upon if something didn't go quite as planned. And Gene shared a couple examples with you that didn't go quite as well as he had hoped. But then, the wound care center that we're going to talk about a little bit later, I think is a stellar example of things that went really well across the board. And then the other thing that is a potential con is that lack of time, lack of resources, and so that ties right into the cost of measurement. And if you can build that into your budget as you're looking ahead, as you're planning your fiscal year budget, to build in some measurement dollars, that's wonderful. Typically, programs and program directors, executives are reluctant to carve out measurement dollars from a marketing campaign. So you almost have to have that in addition to what you've already budgeted for the marketing campaign. So on the next slide, Gene says that if you are doing that, that statistically only 10% of organizations surveyed by, in small print you could read how much firms are spending by a CMOsurvey.org for measuring key marketing metrics. And so if your organization's already doing that, congratulations, you're in a pretty elite group in the top 10% in the country. So ideally, what will happen when you do measure marketing effectiveness, it will actually identify the gap that exists between the strategy and the objectives that you set out and the actual execution, so that You can then determine whether your strategy / objectives were effective or not, and then if not, what adjustments can you make as you're going forward. So top challenges should always be ROI focused, and so Gene's got some, I think, some pretty good questions that you should consider in looking at this. Return on investment, what marketing activities and strategies improve your ROI? What metrics are used for ROI? How do you measure ROI on consumer insights? And, one of the things I'll mention here is that, there's different types of research. There's focus group interviews, there's pen and paper interviews, there's online interviews, there are questionnaires that are self-administered, there are telephone interviews. And one of the things that you probably have heard before is that if Walt Disney had conducted focus group interviews, neither Disneyland nor Disney World would have ever passed muster in a focus group environment. And so there are some times when you really can't get the customer insights on something that you're going to be developing that really no one else has. And so there are limits to research. So as we look at the next one, what marketing activities and strategies improve ROI? Well, we want to do those that align with our organizational objectives. And where I would like to insert some OSF flavor to this particular slide, in addition to what Gene has there with alignment equals strength, impact, and return on investment, is that we have in OSF 5 major goals, and we've had these 5 major goals now for the past 2 years. And supporting those goals are 17 strategic initiatives. And as we were looking at those this year, people that aren't among the top executives were challenging them and saying, as many things as we're trying to do, 17 is a lot to support these 5 objectives. Can we come up with what are the 5 most critical strategic initiatives to support these goals, if indeed we don't have time or resources to do all 17. And so the executives were able to not come up with a top 5, but they came up with a top 7. And so what we are doing in marketing and communications is we've identified, what are those top 7, and if a program or service that wants to be marketed or communicated does not address one of those top 7 initiatives, then we're saying we're not going to actively do any type of multimedia campaign to support that. So we may do something to support it, but it's not going to be very active or very aggressive because the organization has not aligned that particular activity to go ahead and pursue it. And so for us, and I'm sure it's the same with your organizations these days, resources are very tight, whether it's human resources, capital, or it's your normal operating budget. And so we want to be really effective, and so everything really should be able to tie directly back to one of your strategic initiatives and or goals. So on the next slide, we have marketing priorities, demand and brand, where we promote individual clinical services, or can we look at brand building or demand generation? I think Bob did a really nice job of sharing different examples in that regard. So on the next slide, we have organizational priorities. So these are some of the things that if you're an administrator at a hospital, that operational efficiency is front and center. And I know Dave, in his consulting capacity, he's looking at meaningful use dollars as a way to help organizations bolster their bottom line. And so he's looking at probably all three of these as organizational priorities. And so for us in marketing and advertising and public relations, how can we help with that? And a lot of times, in terms of demonstrating impact on health quality or demonstrating stewardship, we can look to our ad agency partners or our media partners who can tell us this is how many people we've reached, this is the frequency. We can look at how our dollars are being spent on a cost per thousand basis and look at that, whether that's online in the clicks that we're getting, or is it billboard advertising, the number of drivers or people who are going by a particular billboard, is it how many people are viewing our spots in a television program. So those are some of the things that we can do in terms of efficiencies. So the next slide says demonstrate value, but if we go on to the next one, what metrics are used for ROI, a lot of times, the revenue per patient, but then, how do you actually, garner that revenue per patient? And that's where I explained in the first session with the ACHE Downstate Illinois chapter that's a challenge for us when we were tracking our first appointment for neurosciences. We had to work with a couple different individuals in decision support services and in the neuroscience service line to do a lot of handwork on that. And so that's one thing is, how do you identify what that revenue is? And then the next one here is click to conversion rate for online campaigns. And so one of the things that helps is that when you do things online, you're able to go ahead and get tracking automatically from whatever type of source that you're using, and so that can be very helpful. And as we look at that online, you can actually set targets and measurable goals. And so as we know who the target audience is, we can do what's called Google Analytics, and we can do objectives in Google that will enable us to see whether or not we're meeting key targets. And so there are ways, in addition to Google Analytics, that you can use in pay-per-click campaigns where you may be using either your ad agency or it could be another agency that provides you that online resource that can help you track what your impact has been. And then it really is up to the organization to be able to track it electronically with that patient revenue. So if we go on to the next slide here, where we have methods of measurement, this is not too unlike what I referenced earlier, where we're tracking measurable fee-for-service volume, direct inquiries, interactive, and then we have the quantitative consumer assessment research. So as we look at direct inquiries, a lot of the pay-per-click campaigns that we can do online, we can get people to go to a landing page and they can opt in for us into allowing us to send them email messages. And so we can look at how many people have signed up, and then how many people are opting in to have that regular communication from us. And so as we look at interactive, certainly our website, but I'll bet everybody on the phone participating in this particular webinar has a smartphone. So you are connected mobilely, and you probably have, a Facebook account, you probably have a Twitter account, and if you don't, some loved one in your family does, and so you're familiar at least with those terms and how you can interact across the board. And then the last item here is quantitative consumer assessment research, and I think if we go to the next slide, I think that has some top research tools that will expand a little bit on the quantitative consumer assessment research. And one is consumer surveys, and so consumer surveys, as I referenced before, can be done and administered a lot of different ways. They can be administered online with a panel, and you would go through a consumer research firm to do that. They can be, again, the same consumer research firm may have the capability to do telephone interviewing, certainly doing interviewing via mailed questionnaires. We at OSF Healthcare, we use Press Ganey for our patient satisfaction surveys, and a lot of our patient satisfaction surveys continue to be mailed questionnaires to patients' homes who fill it out and return it via a postage-paid envelope. And so that's how you can get some regular feedback from patients. And so it goes from as elementary as filling it out paper and pencil as sophisticated as online. I've already referenced focus group interviews, and Gene also has a couple insights here, and he notes that, you know, what people say rarely correlates to their behavior, and he said, you know, focus groups can be notoriously unreliable. You know, I have an example. You know, Dave referenced, you know, my earliest jobs were with the William C. Publishing Company, and I did focus group interviews with professors in convention settings in a lot of major cities throughout the country during my 4 years with the William C. Brown Publishing Company. And one of them I did in Los Angeles at a national convention, and we had a lot of major universities that were participating in this particular focus group. In fact, there were 10 individuals who participated who were full professors in of all things, biochemistry programs. And 8 of the 10 were from the largest universities across the United States. And so as we did the focus group interview and the editor for the sciences participated relatively quietly in the room, we learned that these schools all had 3 introductory biochemistry courses. And one was for just their general students, one was for science, their science majors, and then another one was for their pre-med and their chemistry majors. And so when we got finished with that focus group interview, the editor was beside himself, being so giddy at the prospects of having 3 books that he could really multi-purpose and cross-purpose from the author that he had signed. And I said to him, I said, his first name was Harry, I said, Harry, we can't go on this focus group and just think that there are actually 3 major markets for an introductory biochemistry textbook. He said, but Jim, we just heard that all of, I said, that's a very biased group. I mean, we have the largest universities. I said, let me do a survey of all the universities and the 4-year colleges and find out how, you know, just how prevalent these 3 course levels are. And so we did a quantitative study, and what we learned is that indeed those were the exceptions. And as we canvassed it, we only found 2 more universities in the whole country that had 3 levels of introductory biochemistry. And so we built books for just 2 levels, a science group and just a general purpose. And so that really does reinforce that, you know, focus groups can be unreliable. And at the same time, it did give us really good insights. And so we've done focus groups where it's been very helpful for us to give insights in terms of, you know, groups of employees explaining what they mean when they, you know, rate low, you know, their community's perception of their respective hospital is lower than say other hospitals throughout our ministry, and we've done focus group interviews to identify some of those reasons. So having said that, let's go to the next slide. And I know we're coming up on our time here, but as we look at this next slide, traditional research methods, you know, give us an opportunity to understand the needs and wants of audiences, market dynamics, enable us to do some benchmarking, and then, as we're talking about, measuring marketing effectiveness. And so on our next slide that Gene has, which is the solution, well, the solution really is use an integrative approach to reach and understand your target audience. And so the key here then is, who is your target audience? So as we go to the next slide, we have an opportunity to produce a quantitative consumer assessment research that delivers. And so I think I've pretty much referenced most of this in going through the focus group and then talking about the strengths and weaknesses of different types of quantitative methods. So if we scoot to the next one of case studies, Gene references on this slide, the IVCH, and what he would like you to know about this is that he says there's a fantastic tool right under our eyes that can be used to measure content marketing, and that's Google Analytics. And so Google Analytics doesn't give you the value of the content, but with the right configuration and URL tagging, you can directly tie the pieces of the content to your potential revenue that you've garnered. So as we go to the next one, Gene wanted to just refresh people's memories about the Wound Center campaign that he addressed in the first session. And what they had was they had a print campaign that was complemented by 30-second radio spots online, and then he did a lot of free media. They actually were very effective with their free media, and they had 4 opportunities where they got a lot of free publicity. One, they did a news conference for the building announcement, which was big news in the LaSalle, Peru area. The second opportunity came with a groundbreaking, so they had the media there for that, and they had VIPs and community leaders in addition to hospital folks. Then they did a construction photo to show people the progress that they were making. And then finally they capped it off with a ribbon cutting, again, with different dignitaries and hospital staff. And so they got a lot of free publicity as a result of that. And one of the things that you can do with Google Analytics as well is you can get Google reports and find out how many times your particular organization was referenced in different mediums. So you may be tracking your local newspaper, but there may be weekly newspapers that pick that up as well. And so the next slide simply shows a couple of the print ads that Gene has, and then the very next slide shows the online visuals that he used. And then the second last slide, or third last slide we have here are some of the statistics, and looking at the success that Gene and his team have been able to generate. And you can see as the bar moves from left to right that what we have is, what you see is July, August, and September numbers in terms of patient visits on the far left, and then looking at the wound visits on the far right. It's a steady growth. And as I talked to Gene yesterday, he said October's numbers are just as strong or even better than September. So it may not be going up quite as rapidly, but it's still continuing to increase. Then Gene also indicated that they did regular posts on their Facebook page for the Wound Center in terms of hours and the providers, and then that kind of complements the traditional media that they had as well. So with that, the last slide just goes to questions and answers. And so Dave, hopefully you won't have any really tricky questions for Bob and I, but if you do, I'm sure Bob will be willing to answer them because I need to.
Thank you both to our speakers, Bob and Jim. We appreciate all your expertise and wonderful information you shared today. As you discussed, the line is open for questions to ask our speakers and have an opportunity for discussion. And I know there's a couple questions that are pending, so I can go ahead and just present those to the speakers to answer, or you can unmute your line and ask yourself if you'd like. in with one of the questions. Of the 5 P's of marketing, which is the most important in the healthcare industry? And how would one prioritize the 5 P's of marketing in the healthcare industry?
I don't know, Bob, if you want to address this, but really one is no more important than the other. It used to be that, and I'm not sure what the 5th P is, but I'm familiar with product, price, promotion, and place. It used to be for us in marketing and probably advertising that the P for price was not one that we typically dealt with other than community education programs. But now with Time Magazine and some other major publications coming out and kind of questioning how we have our charge master and how there's such variability in prices for hip replacement surgery or for a tonsillectomy when you compare it to Chicago, to Peoria, to St. Louis, or to Omaha, Nebraska. We are going to have to be more transparent, and that's going to be a bigger impact than it has been historically. So I don't think you can point to one or the other being more important. So Bob, if you want to weigh in on that, go right ahead.
No, I agree with you, and I think it's specifically how you position it as well. So if you've got, for example, diabetes supply company, that's obviously a very, very crowded marketplace out there, a lot of competition. But if price, everything costs about the same. But you've got to position it as, what is your USP, and maybe it's direct to home, free shipping is the one thing, and it's convenience, it's going to help you. So I agree with you, Jim.
Okay. Oh, 5th P.
Our next.
Thank you.
Oops. Sorry, Jim. Go ahead.
No, I just see that the 5th P is people. Okay, good. I didn't know that they were including it as.
Our next question, in healthcare, direct contribution margin and resultant ROI are often not directly related to actual utilization in the way they are in other industries. How do you take that into account when evaluating the effectiveness of marketing in healthcare?
I'll defer to you, Jim.
This is a challenge, and historically has been a challenge. I think what you have to do is probably be selective in terms of the effectiveness of marketing. And the illustration that I shared in our first session, and for those of you who weren't on the first session, it was a first appointment that we had, that we tracked, and we were able to identify people signing up for our neurosciences physicians, and then their visit, and then if they had a procedure or some type of an intervention, how many dollars did that generate? I think when you can do that on an isolated basis and you can see how effective it is, that has a halo effect, that you can look at other programs and services, and if you use a similar type of approach and you track the things that are more easily trackable in terms of number of people who've actually made a visit, and then assigning or estimating some direct contribution margin per person that's been made an appointment, and then you could look at, say, neurosciences. Well, how does cardiovascular compare to neurosciences? Well, it'd be some type of a ratio of that. Probably a proportion of that, as opposed to the something times that. I think that's probably how you do it, and I think at the other hand is that you do have these great metrics that advertising agencies can provide and online organizations can provide in terms of just your reach and frequency, because it's important, given that healthcare is a latent demand, that you have some type of ongoing presence out there, as opposed to being completely invisible, where you go dark for 2 or 3 months, whether that's online or traditional media. Because people are going to come across and they're going to use the traditional media as an opportunity to do word-of-mouth consultations, and so that's one of the strengths of it, and that's, again, one of the challenges is that if you're not out there, then how can people, if they're new to an area, be aware to even ask about you in terms of word of mouth? And so you have to have kind of like a baseline of marketing dollars, marketing investment to maintain your visibility in the areas that you serve. And then on top of that, you would do additional campaigns to promote those programs and services that are tied most directly to your strategic objectives and goals. And then then you should, because of the importance that that has on the organization, be able to measure, is utilization increasing as we expected or forecasted? If not, why not? Or is it more than what we can handle and we need to back away from some things? And we've actually had instances where that happened. A good instance was this past winter. We were going to do a flu mailing to 34,000 Pioneer ACO members to remind them, if you haven't had your flu shot, and this was in middle of February, if you haven't had your flu shot yet, go ahead and get it. If you did get it and you didn't get it from an OSF facility, let us know. And then if you also had a pneumonia shot or a pertussis shot, we'd like to know that too, so give us a call. So we did the first mailing. We're going to do it in waves of 3 weeks apart so that our call center wouldn't be overwhelmed. And what turned out is after the first week, we had so many people who scheduled appointments for their flu vaccine, is that we ran out of flu vaccine because we were near the end. And so we couldn't do waves 2 and 3, because if we did that, then we would have a lot of irate folks that would have called and not been able to get their flu shots. And so, you do have to be able to make adjustments, not necessarily on the fly, but based on utilization.
Thank you. Is there any other questions that anyone would like for Bob and James to address?
There's a question that's up right now in terms of focus groups that, what's a good and reliable alternative to the 5th P of people with the resources? Focus groups are unreliable in terms of wanting to project results from that small group to a whole population. That's where the unreliability comes in. You need to do quantitative research to be able to project. So in my example of the college textbook biochemistry, if we would have just went on those 10 professors and projected that to the whole population of colleges and universities offering biochemistry courses, that was inappropriate and unreliable. But when I did the quantitative survey and I canvassed all of the universities and colleges, then I was able to come up with within a plus or minus margin of error. And I think at that time we got well over 400 replies back, and let's say we got 1,000 back out of the 3,500 colleges. That gives you a plus or minus error of 2 or 3%, and so that's reliable, that type of information. So in terms of the people and resources, focus groups are good for getting insights. And here's an example. We looked probably 5 years ago now at our exterior signage, and we did focus groups in Rockford, in Peoria, in Bloomington, and in Pontiac. And we wanted to find out from people, a couple things. One, did they notice our signs at our facilities? And then, which happened to be mostly Franciscan brown. And then, would they notice them more if we went to an alternative color? And so we showed them different alternative colors, and we showed them different shapes. And we want to get some insights as to, what shapes and what colors might be good instead of Franciscan brown. And so, we talked to probably 100 different people in those 4 different settings, and we got a lot of uniformity of replies. And you see now today that we are still Franciscan brown in our signage because people thought that that was a nice, strong, conservative color which matched their perceptions of who the Sisters of the Third Order of St. Francis are. And didn't want to or didn't think it was appropriate to go to a more contemporary forest green color, and so they also picked out a particular sign shape that was different than the current ones. And so I think that was a perfect application of a focus group because it was very qualitative and it gave us great insights, and we understood why people did that, as opposed to just sending out a mail survey, asking a couple questions on the phone. You didn't get a chance to really discuss and walk through colors and why is one more important or resonate more with you than another.
One thing I'll add to that is, as an alternative, and I'm not saying this is a great alternative, but there are people out there talking about your brand and your products and your services online specifically, whether you ask them or not. And whether that is they're talking about physicians that you may have, maybe on a site like HealthGrades, for example, or they're talking about your service possibly on consumer sites, even like Yelp, review sites out there. So whether that's some sort of online reputation management that is out there that you can start doing. I know we do that with some of our clients, but just taking a look at what is being said out there and creating some sort of matrix or something like that to track all of that. Some of it's going to be good, some of it's going to be bad, and a lot of people think that most of it is bad, but it's really not. I mean, you've got a lot of brand champions and ambassadors out there, pulling for you and actually touting your services and your products more than you probably think. So, and in that, they're always unfiltered comments and responses. So you do get, for the most part, true feelings on how people feel about what you do. So,
I have an additional question. From what has been presented, it appears the greatest challenge in measuring the ROI of dollars spent on marketing programs and campaigns is determining and measuring the proportion of patient encounters revenue is directly related to, associated with the marketing program and campaign employed. So what is the single most important core tool or asset that facilitates this effort?
Wow. You want to go first on that one, Bob?
It's tough. I mean, I'm not sure if there is a single most important core tool or asset. I think it's a combination of things, to be honest with you. And Jim, you might be able to speak to your experience and what you've done on OSF. But I think there's a lot of different ways to measure it. I don't know, Jim. Do you want to?
Yeah. Here's my example. And at one point, we had a customer relationship management software capability, and we regularly did mailings to targeted groups of patients. And so we had an electronic data warehouse that generated groups of patients depending upon what we were promoting, and whether that was heart-related services, if it was neuro services, and then we might have like one or two or maybe three direct mail pieces that we would send to them. And to the point about its effectiveness, we even got to the point where we would hold out people and we'd have a control group. And we had a control group, and we would do what we call the experimental group, where we would send the direct mail pieces. And in each campaign that we did, we had wonderful results relative to looking at the control group versus the experimental group. And our ROI was outstanding. It was sometimes 100, 200%. But the executives didn't put value in that particular analysis because the intervention was through direct mail, and there's all this other extraneous and other environmental marketing, word of mouth, that is going on, and that you cannot actually then say it wasn't just the direct mail piece, Jim, it was all of these other things, and maybe the direct mail piece had an impact, but it wasn't the one that won the day. And because and even working with our CEO to come up with the formula to ratchet down and be very conservative, the executives just never bought into the fact that you could send a direct mail piece and it would actually, move people to select OSF, St. Joseph Medical Center, OSF, St. James, as opposed to the competition. And so we ended up jettisoning that particular, customer relationship management program. And now I'm kind of, as we get into this electronic age, and that was probably 5 or 6 years ago that we did that now people are saying, well, gosh, we have this electronic data warehouse through our Epic EMR. Wouldn't it be nice if we had this CRM tool that we could overlay on top of it? And absolutely it would be. And so I think, to answer the question, I think a CRM tool is really critical to being able to identify what your ROI is. And as sophisticated as those software applications are today, I think it could pass muster now with the CEOs and the CFOs, whereas 6 or 7 years ago it couldn't and didn't, at least in our organization.
Thank you. Are there any other questions for Bob and Jim? Okay, well, thank you very much to Dave, Bob, and Jim for moderating and presenting today. These were stellar presentations, and we appreciate, again, your knowledge and your expertise, and we will definitely take this home and utilize it with our own day-to-day practices. So with that being said, we will go ahead and make sure the slides get sent out to the individuals that were registered, and we hope you enjoy your day and have a blessed day.
Okay,
Thank you very much.
Thank you.